And so here's a particular example. We have a premolar here that has an MOD composite that's failing. And so we're going to go in here and do our ideal preparation design. We'll place our phosphoric acid for 5 seconds. We'll go ahead and rinse that off. And I don't show the actual step of etching and rinsing it off simply because there's no way I can take a photograph and leave that on for 5 seconds without causing extra damage to the tooth. So rather than damage my patient's tooth, I avoid taking a photograph where it's going to take longer. So from there, after you painted the bonding agent on there, the Riva Bond LC, after having activated it in the triturator and painted it on the tooth structure, you'll start to get this kind of appearance. It's kind of a matte gloss kind of finish. So after painting it on, a thin layer, but it is a thicker material, so it is a little bit thicker than the traditional bonding agents, you'll find that after curing it, you'll have this kind of matte finish. And it should still be kind of shiny like this, even though it's matte. If you find that it's actually too dry, if you're desiccating the area, it'll actually show up white or frosty on the tooth structure. And so you can start to see just a little bit of that frostiness maybe right over here. And so this is starting to dry out a little bit. But this is up on the cusp, so I'm going to remove it when I polish anyway. But this matte type of flat finish is kind of what it looks like after you've cured it in place. Prior to curing it, it has a little more of a shine because it's a little more liquidy, the same as it had appeared when I pulled it out of the capsule. Now after having done that, you'll go ahead and, if you have a 4 or 5 millimeter defect here, this is where you could bulk fill it with your bulk fill composite technology, or you could stratify it with various layers of composite if you want as well. Choose your whatever technique works best for you, or you could even fill it entirely with glass ionomer, as I mentioned. So in looking at this, it was a bulk fill of resin technology, one of the modern bulk fill resins. So here we bulked it up entirely. We'd go back and start to remove some excess, start to contour it, and then after curing it, go ahead and remove the matrices and polish things into place. And so you have a restoration here that will have no sensitivity, no C factor on it. Micro leakage should not occur because of the technology in the Riva Bond LC glass ionomer adhesive. This should be a very long-lasting, very durable material for something like this.